Have you ever wondered how masturbation might affect prostate health, especially as you get older? It's a question that many men, particularly those over 50, may not feel comfortable asking, but it's one that's incredibly important for maintaining overall well-being. In today's video, we're going to dive into the topic of masturbation and prostate health, exploring how self-stimulation can play a role in preventing prostate issues, improving mental health, and even reducing the risk of sexual dysfunction. As we age, maintaining a healthy relationship with our bodies becomes more crucial, and self-care practices like masturbation can offer surprising benefits. From reducing stress and anxiety to enhancing sexual health and circulation, these practices may be more beneficial than you think. By watching this video until the end, you'll learn not only how masturbation can support prostate health, but also when it's best to approach it as part of a broader health routine. We'll share expert insights, medical studies, and practical advice tailored to men over 50, helping you make informed decisions about your health. Plus, you'll get tips on how to balance sexual activity with other essential habits for maintaining a healthy lifestyle. If you are not subscribed, subscribe and activate the notification bell to avoid missing any videos. Your support means a lot to me, and if you enjoyed this video, you can help me continue spreading the valuable lessons by liking and sharing it. It's only natural to wonder about the impact that certain practices, such as masturbation, may have on prostate health, especially for those who have experienced or are concerned about prostate-related issues. The question arises, does something as natural and personal as masturbation have any bearing on the health of our prostate? For many, this may be an uncomfortable topic, but in truth, masturbation is a completely natural and healthy aspect of human sexuality. It's an expression of our sexual well-being, and particularly as we mature, it plays an even more crucial role in preserving our physical, emotional, and mental health. I feel that we must begin to view these practices not with shame or guilt, but as an essential component of self-care, an act that allows us to stay in tune with our bodies as they evolve through the different stages of life. Masturbation can be one of the most intimate and empowering ways we connect with ourselves, especially as we age. As we grow older, our bodies undergo various changes, and these changes can sometimes make us feel disconnected from ourselves. This is when self-stimulation becomes not just a physical act, but an emotional and psychological tool that helps us regain a sense of intimacy, connection, and even confidence. To me, self-exploration is far more than just a form of sexual pleasure. It is a form of self-acceptance. In a world where we often feel pressured to look or perform a certain way, taking time to appreciate our bodies can be deeply transformative. Self-stimulation allows us to stay connected to ourselves and accept our changing bodies, reducing feelings of inadequacy that may arise as we age. It becomes an act of radical self-love and care, something many of us need more of in a world that sometimes overlooks our needs as we grow older. From a psychological standpoint, masturbation can be incredibly therapeutic. It's a deeply personal practice that provides an opportunity for self-exploration and stress relief, both of which are crucial in maintaining emotional well-being. The simple act of self-stimulation triggers the release of a variety of hormones in the body, most notably endorphins and oxytocin. These feel-good hormones can do wonders for our mood, acting as natural mood elevators that help alleviate stress, reduce anxiety, and create an overall sense of well-being. I've personally found that the stress relief gained from these hormonal releases can be profound, like a soothing balm for the mental and emotional wear and tear we accumulate in our busy lives. As we age, it's easy to feel isolated or disconnected from others. Loneliness, particularly in older adults, can be an overwhelming emotion, and it's in these moments that masturbation can become a form of solace. For many, it's not just about physical pleasure. It's about finding intimacy and comfort in one's presence. The emotional connection that self-stimulation fosters is incredibly powerful, as it allows individuals to feel seen and valued by themselves, without relying on a partner. It's a beautiful reminder that we are enough, just as we are. For many older adults, this act can be a source of relief, especially if they're no longer sexually active with a partner or if they are experiencing changes in their relationship status. It provides a way to stay in touch with one's sensuality, offering emotional nourishment in the form of self-compassion and intimacy. Beyond emotional health, there is also a physical aspect to consider. Various studies in the field of sexology have shown that masturbation offers significant benefits, particularly for older adults. For many, it helps combat self-esteem issues and reinforces a healthy, positive image of one's sexuality, which is crucial as we grow older. In particular, for men, masturbation plays a vital role in maintaining prostate health and ensuring the proper functioning of the reproductive system. Regular self-stimulation has been linked to improved blood circulation in the genital area. This increased circulation is essential for maintaining the health of tissues and organs in the reproductive system. It promotes oxygenation and ensures that the area remains healthy, potentially preventing several health issues that may otherwise arise. Moreover, masturbation serves as a protective factor against sexual dysfunctions such as erectile dysfunction. As men age, sexual health can decline, but regular self-stimulation helps preserve the functionality and sensitivity of sexual tissues. It's almost like exercising a muscle. By keeping the tissues engaged, you are ensuring that they remain active and responsive. Over time, this can help stave off issues that might otherwise diminish sexual pleasure and satisfaction. I truly believe that engaging in regular, moderate self-stimulation can help men not only preserve their sexual health, but also their sense of masculinity and vitality, which are often deeply tied to one's overall sense of well-being. In my opinion, the importance of masturbation in maintaining prostate health and sexual well-being cannot be overstated. It's not just a physical need, it's an emotional and psychological one too. The benefits are far-reaching and extend into many aspects of life. It's not something to be ashamed of or dismissed, but rather something to be embraced as part of our journey toward aging gracefully and maintaining our health. We live in a culture that often stigmatizes sexuality, especially in older adults, but I believe that embracing our natural desires is an empowering act. There is no shame in nurturing our bodies through these natural, healthy practices. I would argue that it's essential to our overall happiness and quality of life. Taking care of our bodies, both physically and emotionally, through masturbation can help us not only avoid potential health issues, but also embrace our full selves, regardless of our age. If you're still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Ultimately, I see masturbation as a powerful form of self-care, one that we should all take the time to prioritize. It provides not only physical benefits, such as improved blood circulation and sexual health, but also emotional and mental benefits, such as reduced stress, increased intimacy with oneself, and a greater sense of self-worth. As we continue to age, we mustn't overlook how we can support and care for our bodies. Masturbation is a natural, healthy, and essential part of this process. An intimate connection with our sexuality that nurtures our physical and emotional well-being and helps us to thrive in every stage of life. From a medical perspective, there is growing evidence to suggest that frequent ejaculation can have notable benefits for prostate health, particularly for men as they age. Several studies indicate that regular ejaculation helps maintain the health and function of the prostate by preventing the buildup of prostate fluids. One compelling study conducted by a renowned university found that men over the age of 50 who ejaculated frequently had a significantly lower risk of developing severe prostate issues, including prostate cancer. This highlights a key aspect of prostate health that is often overlooked: the importance of regular fluid release. Ejaculation, whether through sexual activity or self-stimulation, helps reduce the accumulation of prostate fluids. When these fluids are not regularly released, they can build up over time, increasing the risk of infections, inflammation, and discomfort in the prostate area, which can eventually lead to more serious complications. In particular, self-stimulation or masturbation can be an effective and convenient way for individuals to maintain their prostate health, especially for those who may not have a sexual partner. The act of ejaculation during self-stimulation serves as a natural mechanism to release fluids from the prostate, preventing the potentially harmful buildup that could cause discomfort or lead to infections. For many men, self-stimulation becomes an important tool for managing prostate health on their terms, without the need for external sexual activity. I think it's empowering that something as simple and natural as masturbation can play such a crucial role in men's health, allowing them to take proactive steps toward maintaining their well-being. Furthermore, research in urology has shown that older men who ejaculate regularly, typically 2 to 3 times a week, report experiencing fewer urinary discomforts related to prostate enlargement. This is likely due to the relief of built-up tension in the prostate gland. When ejaculation occurs, it facilitates the expulsion of accumulated compounds, such as prostatic fluid, from the prostate. This helps reduce congestion within the prostate, ultimately contributing to better urinary function and less discomfort, which can be a common issue for men with benign prostatic hyperplasia, BPH, or other prostate-related conditions. From my perspective, this evidence emphasizes how important it is to maintain a healthy prostate through regular ejaculation, which can prevent complications associated with prostate enlargement. However, it is crucial to understand that masturbation and regular ejaculation should not be seen as a standalone cure for prostate problems. While these practices can be beneficial, they should be viewed as complementary to other essential health measures. Maintaining prostate health requires a holistic approach that includes a balanced diet, regular physical activity, and lifestyle choices that promote overall well-being. For example, eating a diet rich in fruits, vegetables, and healthy fats can support prostate function, while maintaining a healthy weight can reduce the strain on the prostate and prevent inflammation. Additionally, incorporating pelvic floor exercises, such as Kegel exercises, can help strengthen the muscles around the prostate and improve urinary control, further supporting prostate health. In my opinion, it's essential to view masturbation not only as a means of sexual release, but also as an important tool for prostate maintenance. When combined with other healthy habits, it can be an effective way to promote long-term prostate health. At the same time, it's important to avoid relying solely on self-stimulation as a fix-all solution. A balanced approach to prostate care that includes proper diet, exercise, and regular health checkups will always be the most effective way to prevent and manage prostate-related issues. Ultimately, taking a proactive stance toward our health, with an understanding of the role that practices like masturbation can play, allows us to better care for our bodies and reduce the risk of future health complications. It's important to recognize that every individual's health situation is unique, and when it comes to prostate health, there is no universal solution. For men who have been diagnosed with more severe prostate conditions, such as advanced prostate cancer, acute inflammation, or other serious prostate-related issues, the approach to sexual activity, including self-stimulation, may need to be more cautious. In such cases, self-stimulation may not always be recommended, particularly when the prostate and surrounding tissues are compromised or inflamed. Prostate cancer, for example, can result in increased sensitivity in the prostate and nearby areas, making sexual activity potentially uncomfortable or even painful. In these instances, It is crucial to consult with a healthcare professional who can assess the individual's condition and provide tailored advice on how to manage sexual activity during treatment or recovery. Healthcare providers are best equipped to guide men through this process, ensuring that any activity they engage in, including self-stimulation, does not interfere with medical treatments or hinder the recovery process. For men undergoing treatment for prostate cancer or dealing with significant prostate inflammation, the priority should always be on managing the condition safely and effectively. While some may be able to engage in self-stimulation with certain precautions, others may be advised to refrain entirely. In these cases, it's vital to have open and honest conversations with doctors who can provide specific guidance. Some men might be encouraged to engage in sexual activity only once they have reached a certain stage in their treatment or recovery, while others may be given specific techniques to reduce discomfort. These conversations are important because prostate-related treatments, such as surgery or radiation, can result in temporary or long-term changes to sexual function. For example, surgery may affect the nerves involved in sexual arousal, while radiation therapy can cause inflammation that leads to pain or discomfort during sexual activity. A healthcare professional's advice ensures that patients can continue to care for their sexual health while prioritizing their overall well-being. In cases like these, where physical discomfort may arise, it's not just the physical implications of self-stimulation that should be considered. The psychological and emotional aspects are just as important. Men facing a diagnosis of prostate cancer or other serious prostate conditions often experience a range of emotions, including anxiety, fear, and confusion. There's a natural fear that engaging in sexual activity, or even masturbation, could exacerbate their condition or hinder their recovery. This is a valid concern and one that many men face in silence. I believe that the emotional aspect of dealing with prostate health is often overlooked, but it plays a significant role in the overall healing process. The stress, anxiety, and self-doubt that can come from such a diagnosis may lead many men to question their sexuality, especially if they experience changes in sexual function or desire. This is why it's so important to approach self-stimulation from a place of self-care and self-compassion, rather than viewing it through a lens of guilt or fear. Acknowledging that sexuality is an essential, healthy part of life, at any age or health condition, can help shift the perspective. Masturbation, in this context, should not be seen as something shameful, but as a natural, safe, and gentle practice that can help maintain a connection with one's own body during a challenging time. I believe that self-care is critical in any recovery process, and embracing a positive, healthy relationship with our bodies, including our sexuality, can aid in emotional healing just as much as physical treatment can. The act of self-stimulation, when approached with mindfulness, can help reduce feelings of isolation or inadequacy that may arise from a prostate diagnosis. It allows men to reclaim a sense of control over their bodies, fostering a healthier relationship with themselves despite the challenges they may be facing. Psychologically, many men fear that self-stimulation could be damaging or that it could worsen their condition. These fears are not uncommon, and they should be addressed openly. It's important to recognize that these fears are valid and often arise from the stigma that surrounds sexual health, particularly in older adults or individuals with health conditions. Society tends to place a lot of shame and judgment around the topic of sexuality, especially when it comes to health issues like prostate cancer or other prostate-related disorders. However, experts in sexual health and psychology recommend that men in these situations reframe masturbation as a form of self-care rather than a potentially harmful activity. By doing so, they can reduce the stress and guilt associated with their sexual health and focus on nurturing themselves emotionally. An important aspect of this reframing process involves education and communication. I believe that one of the most powerful ways to combat anxiety surrounding prostate health and sexuality is through knowledge and open dialogue. Understanding that self-stimulation can benefit prostate health in some cases by helping reduce the buildup of prostate fluids and maintaining blood circulation can be a source of reassurance. Yet, for those dealing with prostate cancer or acute inflammation, it's crucial to strike a balance. While self-stimulation can play a role in overall well-being, it must always be done in a way that respects the body's current needs and limitations. Again, consulting a doctor is key. Healthcare professionals are in the best position to offer personalized advice based on the individual's unique health status and treatment plan. For men experiencing anxiety or fear about self-stimulation during prostate treatment, consulting with a doctor can provide much-needed clarity and support. A healthcare provider can guide men through the process, helping them navigate their concerns while offering specific advice that takes into account the individual's health condition. I believe that being proactive about discussing these concerns with a doctor not only helps address physical needs, but also provides emotional comfort. It normalizes the conversation around sexuality and health, which is crucial for overcoming feelings of fear or shame. A doctor's guidance can ease these fears, empower men to make informed decisions about their sexual health, and ensure that their actions align with their treatment goals. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. In addition to seeking medical advice, it's also important to recognize the broader context in which these concerns arise. Sexuality is an integral part of human life, and it should be treated with respect, care, and understanding. Men living with prostate conditions should not feel as though they are defined by their diagnosis or their limitations. Rather, they should feel empowered to explore and maintain a healthy sexual identity, regardless of the challenges they may face. In this context, self-stimulation is just one part of a larger approach to self-care that includes emotional support, physical exercise, and a holistic approach to health. Ultimately, I believe that managing prostate health, whether dealing with cancer, inflammation, or benign conditions, requires a multifaceted approach. Self-stimulation can be an effective and natural part of this process, provided it is done in a mindful, informed, and balanced way. It should never be seen as a cure-all or the only solution, but rather as a tool that, when combined with medical guidance, proper diet, and exercise, can contribute to overall well-being. For those facing prostate health challenges, taking care of their sexual health with the support of medical professionals can make a world of difference in both their physical and emotional recovery. By normalizing conversations around sexuality, self-care, and health, we can empower men to approach their prostate health with confidence, dignity, and a positive outlook on their well-being. In summary, masturbation or self-stimulation can indeed be a healthy and beneficial practice for men over the age of 50, including those who may be dealing with prostate issues, provided they are not undergoing treatments that specifically contraindicate such activity. For many individuals, maintaining moderate and conscious sexual activity can play a vital role in both mental and physical health. It serves as an effective way to reconnect with one's body, reduce stress, and promote overall well-being. Furthermore, regular self-stimulation may offer direct benefits for prostate health by preventing the accumulation of fluids and supporting healthy circulation within the genital area. However, it's important to emphasize that each individual's circumstances are unique. Not every man will benefit from the same practices, and in some cases, such as with advanced prostate disease or during certain stages of treatment, e.g., radiation or post-surgery, masturbation may not be advisable. For these reasons, it's crucial to approach this topic with sensitivity and care, consulting with healthcare providers or sexual health experts who can offer personalized guidance based on an individual's health condition. By doing so, Men can ensure that their sexual activities do not interfere with their treatment or recovery, and can instead support their overall health in a thoughtful, informed way. Sexuality is an integral part of life at all stages, and maintaining a positive, healthy sexual life is key to staying connected with oneself. Engaging in safe, mindful practices like self-stimulation, when appropriate, not only contributes to sexual health, but also enhances emotional well-being. By openly addressing these issues and seeking advice from medical and sexual professionals, men can navigate the complexities of prostate health and sexuality with confidence and peace of mind, ultimately improving their quality of life. Taking care of one's sexual health is an act of self-respect, and it helps to foster a sense of balance and connection with both body and mind, promoting a fulfilling and healthy life. As we wrap up today's discussion, let's take a moment to reflect on what we've learned together. We've explored the importance of self-stimulation for men, especially those over 50, and how it can positively impact both mental and physical health, especially when it comes to prostate well-being. Whether it's reducing stress, improving mood, or supporting prostate health, we've seen how conscious sexual activity can be an important part of a holistic approach to maintaining overall health. But now, I want to hear from you. What's one key takeaway that you've learned from this video? Is there something new that you're thinking about incorporating into your own life? Drop your thoughts in the comments below and let us know what you'll be bringing to practice moving forward. If you enjoyed this video, please leave your comment below and don't forget to like, share, and subscribe to our YouTube channel so you never miss out on future content. Your support means a lot, and we can't wait to continue sharing more valuable insights with you. Thanks for watching, and see you in the next video.